Welcome to Dr. Martin, Head and Neck Radiology. In today's video, we will explore the radiological findings and clinical aspects of a sinonasal osteoma. Using a case study of a 66-year-old male patient with nasal congestion, we'll delve into the imaging characteristics, location preferences, and clinical relevance of this benign bone-forming tumor. Stay tuned as we review both axial and coronal CT images and discuss key diagnostic clues. The patient is a 66-year-old male presenting with nasal congestion. A non-contrast enhanced CT scan of the paranasal sinuses was performed to investigate the symptoms. In the axial bone window CT images, a lobulated lesion is observed in the left anterior ethmoidal cells. The lesion has well-defined margins and is isodense with the cortical bone. These features are consistent with the diagnosis of an osteoma. In the coronal reconstructions, the lesion in the left anterior ethmoidal cells is again visualized. It has the same well-defined bone density characteristics without evidence of infiltration into adjacent structures. These findings confirm the presence of a sinonasal osteoma. A sinonasal osteoma is a slow-growing, benign, bone-forming tumor that typically originates from the walls of the paranasal sinuses. It is most commonly found in the frontal and ethmoidal sinuses, less frequently in the maxillary and sphenoidal sinuses. These lesions are well circumscribed and often discovered incidentally during imaging. The best diagnostic clue is a well-marginated, bone density lesion arising from the sinus wall and protruding into the sinus cavity. The most common locations are the frontal and ethmoidal sinuses, 55% ethmoidal, 37.5% frontal, with less frequent involvement of the maxillary and sphenoidal sinuses, 6% maxillary, 1.5% sphenoidal. Morphologically, the lesions can be sessile or pedunculated, projecting from the sinus wall. Their size ranges from a few millimeters to several centimeters, typically between 1.5 to 40 millimeters. Lesions larger than 30 millimeters are referred to as giant osteomas. Sinonasal osteomas are the most common benign tumors of the paranasal sinuses. They are typically asymptomatic and found incidentally. Symptomatic cases may present with sinus obstruction, facial pain, or complications like intracranial or orbital extension. The condition is more prevalent in males, with a male-to-female ratio of 1.5, 2.6 to 1. When multiple osteomas are identified, Gardner's syndrome should be considered. If you're interested in learning more about head and neck radiology, we invite you to watch our video on the radiologic anatomy of the external ear. You can find the link to the video in the comments section below. Thank you for joining us in this detailed discussion on sinonasal osteomas. If you found this video informative, please consider subscribing to Dr. Martin, Head and Neck Radiology. Don't forget to like this video and share your thoughts or questions in the comment section. Your support helps us continue delivering high-quality educational content. See you in the next video.